Once again, good morning, everyone, and we're just going to start now. So first of all, I would like to welcome everyone, including our panelists and our attendees, to the CIO Council Healthcare webinar. Now, the CIO Council Healthcare is an initiative by Khaleej Times in association with Nutanix. The half-day strategic webinar, I wouldn't even call it half-day, it's a couple of hours, is specially designed to keep in mind the challenges CIOs in the healthcare sector face with process transformation, data centers, and IT infrastructure. And if it is one thing that we have realized in these times is how important the healthcare sector is as they've emerged as the frontline heroes in this global pandemic war. Now, every country in the GCC has a great vision where digital transformation roots every single strategic ambition to make healthcare better, more efficient, and people-centric. Now that most processes in biomedical data turn digital, we are finally in the right position to transform healthcare. But with the complexity of hundreds of, being 24/7 interconnected applications and a deluge of biomedical data, we believe that won't be an easy task. Do we have enough resources, people, budget, and time to drive this transformation forward? Well, I would like to first, again, thank everyone who has joined us today from UAE and from Saudi Arabia for this. Also, a few instructions before we start. I would request all our panelists to keep their phone on silent. For all our attendees, should you have any queries, you can ask at any point in time in the Q&A box on your screen. Now, should you want to contribute to a discussion by asking a question or making a point verbally, you can raise hand, which is an option at the bottom of your Zoom screen. Also, keep your comments flowing in the chat option. Our speakers and panelists will try their best to talk to you about it, right? With that note, I would like to start the webinar, and I would like to introduce to you Mr. Mohammed Abul Hof, who's the Director Sales for Saudi Arabia and Bahrain for Nutanix. Now, Mohammed has been in the IT industry for the past 15 years. He has witnessed and participated in major IT digital transformations. He joined Nutanix as the country manager for Saudi and Bahrain for 2 years ago to lead the data center operational transformation in this region towards simpler, agile, and much more cost-effective choices. Mohammed, if I've missed out on something about you, please add. And over to you.
Assalamu alaikum, everyone. Can you hear me?
Walaikum assalam. Yes, we can hear you. Wonderful. I think the attendees are on mute, so they would reply. So you can start.
Great. I'd like to thank everyone for taking out of your valuable time today to be with us in this event. I'd like to welcome you to this event, which targets healthcare industry in specific, which has been one of the most interesting industries and exciting industries for us in Nutanix. For the past years, we had lots of focus on healthcare, but during the past couple of months, we've been instructed by our leadership to pay all the attention and make sure that we deliver all of our knowledge and support and services to our healthcare customers to make sure that your focus stays on your business and on your patients. Nutanix offering today to the market is unique and second to none. Nutanix is the only infrastructure vendor today that makes the infrastructure invisible. All the infrastructure vendors today in the market, they make it a bit complex for dependencies, for higher dependencies on them. Nutanix came up with a new approach, with a new concept of making the infrastructure invisible for you. So your focus always will remain on your business and on your patients. Today, we have some of the wonderful experience in this room from your side, from the customer sides, from partner sides, and from Nutanix as well. And we would like to sit together today to exchange this experience and make sure that we deliver some really positive outcome to each other. We need to understand from you your challenges and pains, and we need to deliver some of the best practices today in the market. So thank you so much for being here today, and I'll leave it back to the team.
Thank you, Mohammed. Thank you for that address. And again, just before we move ahead, I would like to thank Nutanix because it's also very important that these discussions, we have the right partners with us. And obviously this wouldn't be possible for us to do without Nutanix as well. So Thank you so once again. Now, with that, we are going to move to our key address of the day, opening address of the day, which we have done a bit of a change. Instead of a normal presentation kind of a format, we'll be doing a one-on-one Q&A session with the none other than Mr. Hamza Sobi Batterjee, who's the president of HSB Holding. Mr. Hamza Batterjee, as I mentioned, is the president CEO of Hamza Sobi Batterjee Holding Investment and Acquisitions, Megamind IT Solutions, International Skill Development Company, and Home Doctors Home Healthcare. He's also a leader and IT director in Beth Al Batterjee Group that includes the Saudi German Hospital Group. He prioritizes, oversees, and leads the healthcare digital transformation with main focuses to increase efficiency, reduce manpower, and improve bottom line by using and building top world-class healthcare solutions to address needs. Now, seeking efficiency in all business activities continues to be his foremost concern to help achieve the optimum and sustainable level of performance and productivity. So I would like to welcome Mr. Hamza Batterjee. Mr. Hamza, good morning. It's a pleasure to have you with us. Like we always do for all our webinars, we would like to start with asking you, how are you doing today? How has this lockdown treated you? And I hope everyone in your family is healthy and safe.
Thank you very much. I would like to thank you and Khaleej Times and Nutanix for inviting me here. I am well and healthy, and my family are well and healthy. As you may know, Beth Al Batterjee Holding, we are the owners of Saudi German Hospitals Group.
Yes.
We are the largest private owner of hospitals across Pakistan to Morocco. And our main focus and purpose in our family is to relieve suffering. So during this pandemic, actually, we are at the forefront of actually relieving suffering and saving lives. And we are proud of it. And that's our main purpose.
Absolutely, absolutely. In fact, just to add to what you said, I was just reading an interview of your father the other day, and he always very famously mentions that we are in the business of saving lives. And he doesn't like, or the group doesn't like, whenever someone says that it's about anything else. It's the major focus is saving lives. So it's very great that you mentioned the same thing. And it's good.
Absolutely, yes.
Exactly. And it's good to know because, as I mentioned, the healthcare industry has emerged as the frontline heroes in this war against the COVID-19. So with that, we'll start an interaction with you today. Mr. Hamza, my first question to you is, what, according to you, has been the key learnings for the healthcare service providers and for the Kingdom of Saudi Arabia from this pandemic? I think that's a very, obvious question, but also I think we would like to know, what do you think as a healthcare leader, what the learnings have been for the country and for the sector?
Well, from my point of view, I look at health services from different perspectives, as I operate home healthcare services in Saudi Arabia. And I also overlook IT solutions, which we have care information technology solutions. And of course, I oversee the environment of Saudi German Hospitals Group. During this pandemic, actually, we have actually expected the unexpected. So during this pandemic, the companies or the healthcare providers that were equipped or had a strong core of IT background or IT core investments, they would have been able to overcome this pandemic or actually have dealt with it better. But the actual healthcare providers that were actually neglecting IT, like the previous practice earlier, and having IT as an enabler, have actually faced a lot. And as you know, right now during this pandemic, a lot of problems happened or crises happened for companies going out of business, etc. So especially healthcare providers. So the key learnings in this case is having, of course, an agile solutions, systems that can be quite fast, flexible, reliable to provide our patients the best care. In this key learning, I think the telemedicine was a key factor over here. The telemedicine patient portals are areas of investments right now during this time, and they were very important for healthcare providers to overcome this pandemic. Not only that, the risk management and thinking, it was increased across this domain, as you may know, the risk that the companies have faced during this.
Yeah.
And of course, if we had the remote monitoring to add better patient control and better patient monitoring. And of course, last but not the least, of course, is the in our Saudi German hospitals, what we benefited more were the hyper-converged infrastructure, which we had from Nutanix. We have done that in our hospital, in Saudi German hospitals in Ajmal, and also we have done it in Saudi German hospitals, Dammam. And we're planning to look more into this area. But this area have actually helped us by having the actual IT domains and IT people not to be on site. As you know, we had to work remotely and all that. So that was a very big factor.
Absolutely. And it's great that you mentioned about what you have done in these times and how on the hyperconverged infrastructure you have looked at implementing that within your, which brings me to the next question for you, is that how do you think a CIO's role will evolve in the sector after the pandemic? Do you think it will be the same, or do you think it will change from what it was before the pandemic?
Well, for me, I'm a president across both a provider and I oversee provider organizations. I am an orchestra across multiple CIOs. Within this case, IT have actually changed. IT CIOs will evolve right now, especially after or post this pandemic. They would definitely be having deliverables. So for example, if a healthcare provider outsourced their IT, which I am pro for that, that IT provider or IT outsource company should definitely be on their toes in providing deliverables on what they're going to be doing and clear digital transformation plans. And as for the CIOs within this healthcare hospitals or providers, these CIOs should definitely be prepared and to have these deliverables, be proactive, go to their management, create ideas, and see how they can improve their businesses by having efficient solutions and cost optimizing solutions, in other words.
Absolutely. So I think what you also mentioned is you also covered a bit of points in terms of challenges, but are there any specific challenges? I asked you about how their role will change as a CIO, but do you think the challenges that they were facing as CIOs in the healthcare industry before the pandemic, that will stay the same, or do you think it's going to be a whole new world of challenges for them after the pandemic?
I think so. Basically, the organizations that have not invested in IT, they will be facing a lot of challenges, and the ones actually also have invested in IT, they would probably go into prioritizing their efforts and deliverables. As you may know, right now, IT earlier was just an enabler, but right now IT is not an enabler; it's a driver, not only a driver, but a transformer.
Absolutely.
So when I say an IT, a transformer, I say a leader. IT is the main factor in the operation of the actual hospital or the healthcare organization. Yeah. So CIOs should be more proactive by providing clear, strict plans and deliverables. That's how I see it.
Now, Mr. Hamza, coming to the next question. Now, for the Saudi German group, which has been a crown jewel in the healthcare space of the region in the Middle East, which is envisioned by your family. What does the future hold in terms of technology? Because I know you're the man in charge when it comes to technology implementations. So what does the future holds for the group in terms of technology?
Well, the world is evolving right now.
Yeah.
There is a digital disruption that everybody should know about. Companies that have not invested in IT are going to be facing a lot of trouble. This is the time where switch your gears, get ready to really equip yourself, your mindset, your teams, have IT within your board, think future. They say think sci-fi. How about that? You do think sci-fi and really focus on the future in terms of technologies for ourselves. And the efforts of Engineer Sobhi Baterjee, who is the president, and my uncle, Dr. Khalid Baterjee, have done a great job for us. We definitely need to sustain that legacy and expand. So for us to do that, we have actually decided in investing a lot in IT. So the areas that we would be investing in, of course, is AI, that's for sure. We would be definitely moving away from passive technology and going towards RPA, which some of you may not know, or of course you would definitely know, is the robotic process automations. Not only that, going into new programming languages like the low code, etc. Going into the TeleX solutions. Last but of course not the least is going into the hyper-converged. So basically we want to go from downsizing into the data centers in every single hospital to be more cost-effective and robust, consolidated infrastructure and smart solutions like the HCI, which is the hyper-converged solutions. So we can really embrace this data centers which provide a clear direct return of investments, which everybody would like to have is direct, clear return of investments. And that's where digitalization impacts the business. It's direct return of investments and super fast direct return of investments. Yes. And of course, efficiency. Yeah.
Absolutely. And so if I have to summarize what you just mentioned, I believe your focus is on automating a lot of stuff, and at the same time, moving your focus to the patient and business services that you can probably contribute more as an organization. Is that, would that be a correct summary of how you to utilize technology to automate a lot of stuff that can make work faster and with precision and efficiency? At the same time, as an organization, you can concentrate on your business and patient services as well.
So let me tell you, healthcare worldwide have not yet proven itself.
Yeah.
Not like other industries. So other industries have actually proved themselves by having clear cost optimizations and all that. But in healthcare, you tend to find many departments have a lot of fat, and we do not want to have that. And we have actually seen that and actually really experienced it during this pandemic. So basically, we would like to reduce this fat by reducing the manpower. However, we reduce this manpower by putting them somewhere else, of course, within the organization. And of course, having solutions that will increase the efficiency and reduce the most important thing is the bottom line. Not only the most important thing is having focusing on the patient-centric and providing the best patient experience.
Again, now the next question is kind of a follow-up to the previous question. Mr. Hamza, in this entire conversation, you have mentioned about how you see IT playing a key role in the healthcare sector, how you see IT enabling the future of the Saudi German Hospitals Group, but also as a technology leader, what do you think, how would you want technology to be addressed by the stakeholders of the healthcare industry? Because just to elaborate on this question, a lot of times when we talk to technology leaders, they face a major problem in probably kind of convincing the stakeholders for the investment that it needs for probably getting them on board. So how do you think the technology leaders should probably address this situation in the organizations and get the stakeholders on board to have a plan ready or implementation plan ready for technology?
Well, as you know, healthcare IT is quite complex. There are
Yes.
hundreds of companies, hundreds of solutions. What would be your next steps? Where would you go? And all these questions come into authorities or leaderships or stakeholders' minds.
Yes.
So what I believe is, if authorities actually put some regulations of actual solutions to be implemented within the healthcare sector, not only that, but also to have an incentive program for these healthcare providers. So when there is an incentive program and there is a clear regulations for every single solution that should be placed within your healthcare system, then then the actual country would have a real digitalized system and a patient-centric system. And that at the end of the day, we tend to work towards that direction.
So
An incentive would have these healthcare providers really be on their toes.
So if I have to again summarize this, I think what you're hinting at is that the regulators and the providers have to work very closely and ensure that they move hand in hand for the progress of the sector. Right?
Absolutely, yes. And to have incentives programs.
And the incentivization.
Healthcare providers implement these solutions. That's
Absolutely,
sure, yes.
Absolutely. Now, Mr. Hamza.
So at the end of this, so we can get the best patient experience for our patients.
Absolutely.
Don't we want to do that? So we need to have a clear digital system.
Absolutely. Yes. Yeah, I think at the end, it comes down to the patient experience and the services that you're able to provide and the quality of services that you're able to provide. Now, yes. Mr. Hamza, we have seen a lot of leaders in their lives have a famous quote that either they come up with or a famous quote by someone who they look up to. Do you have a quote in your life that you always probably tell people about or you live by, or from anyone that you look up to?
Yes, I do. I have a quote from engineer Sobhi Baterjee, who is my father, who is the owner of South German Hospitals Group.
Yes.
What man wants, man gets. It's all about passion and persistence.
Absolutely.
So if you think you can, you can. And if you think you can't, you can't. It's all up in the mind. So simply believe in yourself and do what you believe you can do.
Wonderful. And I'm sure he's proud because he's watching us right now while you're giving this. So I think it's a dream for any father that the son is able to live by the principles that they have followed in their life. So congratulations to him and you both on that. Which, Mr. Hamza, brings me to the last question is, now, what are the new technologies that the SGS group is looking at implementing in the near future? Could you probably, you have given us a hint in this entire conversation. Could you elaborate a bit more on what you're focusing on?
So as I said, to mainly have your main principles drilled down, what do you want to do? As we said, the healthcare system or the healthcare solutions are an ocean. Know what you want to do, where you want to focus, and set your priorities. As right now, there's no time to waste. Set your priorities, sit down with your management, know what you really want to tackle, and so on. As I said, for ourselves, we are actually focusing on the tele-X solutions like the tele-ICU, the tele-radiology, and etc. in multiple tele-X solutions. Not only that, we also want to go into, of course, the intelligent, the hyper-converged infrastructure.
True.
And of course, into cost optimization solutions. As long as we increase the efficiency, reduce manpower that we can replace somewhere else, and of course, improve the bottom line. So anywhere within that domain, we tend to focus our arm length toward that direction.
Wonderful. Mr. Hamza, I'm sorry.
And of course, AI platforms, which the whole world is going towards.
Absolutely. Mr. Hamza, we'll be taking questions from the attendees, but just one very interesting thing that you mentioned, and I would like to kind of put you on in the spot over here. There's a global conversation happening on the impact of AI, and it's very interesting that you mentioned with more efficiency, more automation, reduced manpower. So as a leader, how do you balance the impact of emerging technologies like AI on the manpower reduction? Because I think it's a very delicate balance that leaders have to maintain. So is it something, do you think that AI is, as the global discussion goes, is going to take away jobs, or do you think it's going to supplement jobs when it comes to the healthcare sector?
Look, AI and others, AI is a thin line. Where you need to be careful towards using AI. But of course, while in parallel using AI, you need to have change management. So at the end of the day, as long as if you do some solutions on top of an AI, also you need to have, because AI is a predictive, is an artificial predictive solution, which will predict for you what are the next steps. So when you introduce such solutions, you need to have this change management, and of course, at the end of the day, as long as you please the end users, then you would have a clear cycle within that area.
I think, and it's a very practical approach to look at as well, and that's the way I think everyone should progress. So at least you've been honest in admitting that there's a very thin line when it comes to AI. We have to be careful about how do we implement it. So thank you so much. I think we have Mr. Sobi Batterjee, who wants to say something. He's raised his hand. Mr. Batterjee, you're live right now. You want to say something?
Everybody.
Good morning. Hello.
Yes, I'm at home, so excuse the way I look, but what I want to add to what has been said, that the problem in this part of the world, whether it is Saudi Arabia or developing world in general, is that automation in healthcare, in my opinion, must be mandatory. We're talking about people lives, right?
Yeah.
We're talking about the most precious thing, which is our lives, our children's lives, our families' lives in general are precious. So I say, and I've been asking for this since the past 30 years, that, and I hope that everybody will take the message upward, that IT must be mandatory in healthcare. And it's not really difficult. It's not really difficult. You know, the HIPAA law that came up in the USA, we could, as a matter of fact, I have written in the past a detailed plan for the Ministry of Health in Saudi Arabia to make IT in healthcare mandatory, and it does not have to be, you know, all at once. It can be, you know, for example, if I will just take 2 more minutes and then I will.
Sure, no problem.
It will be, you know, for example, make mandatory patient registration IT mandatory. The ministry will come up with, will ask for a certain package to be described, a specification to be written on patient registration, for example. And this package will be announced, and tenders, vendors will come up and say, okay, my patient registration package will cost 1,000 riyal, 2,000 riyal, etc. And there will be preferred providers or approved providers by the Ministry of Health, and everybody can go and buy this package, which is announced earlier for patient registration. And then we'll go, for example, for pharmacy module. And then we'll go maybe for medical record module. And then we go maybe for kitchen module, and so on. And the regulator, by setting these dates and these packages in advance and announcing approved vendors to do these packages and make sure that these packages are all interfaced and can be interfaced, I think by maybe 2030, we could have all, or maybe 2040, we could have all organizations in health in Saudi Arabia, for example, all are IT and all can be connected, and Ministry of Health can even monitor them, monitor their
Yeah.
performance, remotely. I see this as a must, in my opinion. That's all. Thank you for giving me the chance to at least express this dream, which is still a dream. Thank you very much.
Thank you, Mr. Batterjee. I think what you mentioned is absolutely correct, that I think there has to be a more aggressive approach to using.
That's it for me. That's my question.
Sorry, I think your voice is breaking up. It's wonderful that you have such aggressive views about technology in the healthcare sector. And Mr. Hamza, I think we're getting a lot of compliments, as you can see in the comment section, for what you've said. Thank you so much for joining us. Before we let you go, I think we would like to take the one question that has been asked, which is, what is the biggest challenge that you see for this promising digital transformation that you have? What is the one biggest challenge that you see?
As I said, one of the biggest challenges is there is no, if we would like to have a clear digital system, we would like to have a clear regulations and clear incentives plans from governments. But of course, what I would definitely see as a challenge is to have healthcare system to be unified, with clear patient numbers, like the airlines. You see a clear passenger number worldwide. We would like to have such thing, or within the country, to have a unified patient file that the patient can access wherever he wants. And I think that is the future goal that the government would like to do, and we're heading towards there. But within the healthcare provider itself, challenges is IT is not an enabler, IT is a driver. Switch gears and get your CIO or get your outsourced IT company that is managing your healthcare provider business. Get them to provide you a digital transformation plan with clear roadmaps and deliverables.
Absolutely. Thank you so much, Mr. Hamza. It was a pleasure having you with us, and thank you for this wonderful speech. As you can see, the people loved it. And I'll see you again during the panel discussion as well later in the day. So I'll see you again. Thank you so much for joining. Wonderful. So ladies and gentlemen, that was Mr. Hamza Batterjee joining us for the opening address. Now we would like to move on to our keynote speaker of the day as well. Dr. Rakesh Suri, he is the Chief Executive Officer of Cleveland Clinic, UAE, and the Chair of Thoracic and Cardiovascular Surgery. Now, Dr. Suri is, as I mentioned, is a CEO, and he's the Chair of the Cardiovascular Surgery at Cleveland Clinic, Abu Dhabi. In his role, Dr. Suri oversees the hospital's overall strategy and effective operation as the first ever US multi-specialty hospital to be replicated outside of North America with more than 5,000 caregivers. Now, he's an international thought leader on innovation and the future of healthcare. Under his leadership, Cleveland Clinic Abu Dhabi opened the first multi-organ transplant facility in the UAE and developed a state-of-the-art oncology center offering an integrated and transformative approach to diagnosing and treating cancer for the region. So, ladies and gentlemen, please welcome Dr. Rakesh Suri. Dr. Rakesh, good morning and welcome, and thank you for doing this.
Good morning, Abu Dhabi, and the entire audience. It's a pleasure to be here from sunny Abu Dhabi.
And we see that you're completely dressed for the occasion as a doctor.
Yes, we're every day I try to get out in the hospital and see our patients and our caregivers. It's a large facility with 6,000 caregivers. And when I'm able to, I really enjoy getting into the heart surgery ORs, operating rooms, and cath labs. We've started business, so we're fully functional again, which is a delight.
Absolutely, absolutely. Now, Dr. I think we start all our conversations with the first and most important question on how are you doing? How's your family doing in these times? And I hope everyone is safe and healthy in your family as well.
Thank you so much. Indeed, they are. My children are here with me, and we are enjoying the family time that has been facilitated by social distancing. It's really led to many benefits in strengthening the family and having children being around their parents in evenings, as opposed to running off to shopping malls and movie theaters. So very, very much enjoy it, and everybody say thank you. And I hope the same is true for your family and everybody online.
Thank you so much. Yes, it is. And I hope the same for our attendees and everyone online as well. So Dr. Suri, I think it is the most obvious, but the right question to start off with is that pandemic has made the world sit and take notice of how countries should focus more on healthcare, even more than what they had been. Now, do you think we are going to see a new era for the healthcare industry in terms of its rise?
I really do. I think that we have entered a new era, and we will never go back. We had a very siloed healthcare system globally prior to COVID. And what this has done is taught us that a public health concern in the Far East can quickly spread to the Middle East, to Europe, North America, and potentially back if we do not act swiftly, in a scientifically organized manner, and in a coordinated fashion. These are the biggest lessons for global healthcare that I would say. The other realization and silver lining to this, so to speak, is that we are now taking therapies and social distancing and public health policy that are being identified in one part of the world and very quickly deploying them in another part. This, I believe, is the first example in the history of humanity where we are doing something for the global benefit of humankind in this way. And that itself is very, very exciting. Unfortunately, COVID has had to teach us this, and very many people have been hurt or died.
Yeah.
But within that, there is this phenomenal benefit. And I'm saying this because we mustn't lose the tremendous momentum that we've gained as a result of this.
So it's also unfortunate and safe to say that it's the crisis and adversity that brings us together as a human race. So
it has, and I've never before, I don't know of a specific circumstance where the human race and human beings have been brought together in this way.
Absolutely.
Even if you think about, wars or other types of epidemics in the past, there's been nothing of this scale that has ever impacted us and led to such a global response.
Absolutely. I think you're absolutely on point over there. Now, Dr. Suri, moving on to our next question is, what is your organization's outlook to healthcare, and how has it changed in light of this pandemic, especially from an employee perspective? Because we all know we are also in due course of this interview going to talk about how it's going to change for the sector, but how has it changed from an employee perspective?
At Cleveland Clinic and Cleveland Clinic Abu Dhabi, we have 3 strategic imperatives. 1 is listening to the voice of our patients. 2 is taking care of our caregivers. And 3 is sustainably growing the organization so it continues to be a backbone of high-end center of excellence care for decades to come, and including research and education. The underpinning of all of that is our caregivers. We are here because of our patients and our students in the community, but we're able to deliver because of our caregivers. And this has been underlined and highlighted in a very, very real way during COVID. We have focused extensively and daily on our caregiver well-being. We have protected them not only from infection. We're thankfully one of the safest hospital environments anywhere on the planet, in one of the safest cities anywhere on the planet. We have been able to test nearly all of our employees to date. We have a routine screening program where we randomly screen. Once patients have any symptoms that could be related to COVID or flu, we ask them to stay home, to self-isolate, to test. We send the testing to them.
Yeah.
If they need to be quarantined at home for either travel-related reasons or health-related reasons, we have developed a system where we check in on them at home. We send nurses and caregivers to them with care packs such as gloves, masks, thermometers, food, to ensure that they are cared for and that they can heal as quickly as possible. So that's the medical side of things. We're delighted that we've had no caregivers who have fallen very, very ill. Some have had some mild illnesses, but the rates have been much lower than we've seen in other parts of the world. That's their physical health. Mentally, emotionally, spiritually, existentially, we look at the whole human being. We realize that healthcare workers are experiencing profound, traumatic sort of experiences. They're going through profound traumatic experiences as a result of what we're seeing locally and across the world. And many on top of that have family situations that are causing them distress. And therefore, we have escalated and elevated and diversified our set of offerings for our caregivers' mental, emotional, spiritual well-being. We're asking them to sleep 8 hours a day. We're asking them to exercise routinely. We're asking them to work a constrained number of hours, not to get burnt out and to let the immune systems drop, but to stay healthy and stay fit and stay highly able to fight off the virus. We're asking them to participate in things that allow them to de-stress, meditation, mindfulness, spiritual practice, whatever works for them, whatever their preference is in a culturally appropriate way. And then we're asking them to spend time with their family and friends in a socially distanced manner, adhering to social distancing protocols, and virtually. So we're really looking at the whole caregiver. And then the final point is that we are preparing for the long haul, Abhinav. We fully expect that we will be living with COVID as a new normal for the foreseeable future. And I say we, I mean globally in healthcare.
Yeah.
And therefore, we're asking people to pace themselves in terms of not traveling when it's dangerous, but rather leveraging virtual means, digital communication, and staying locally when they can in this very, very safe country and very safe Abu Dhabi. So we're looking at the whole caregiver and ensuring we prepare for a marathon here.
I think that's really heartening to know on you do not only concentrate on giving the right services to your patients as well, but to your staff as well. And I think that's a wonderful benchmark and example that you're setting. So thank you for that. Now, Dr. Suri, you mentioned about social distancing. Now, as concepts like social distancing become the norm, do you see a rise in virtual healthcare services?
Yeah. So what's fascinating is that we always planned an entree and an initiation of virtual medicine. And that means telephonic and video. What this pandemic has done is fast forwarded not only the technology, but the deployment and the willingness of both providers and patients to try it. What we found is fascinating, Abhinav. There has been a rapid adoption of this platform. We went from 0 to 1,500 plus virtual appointments a week, and it continues to grow. Even now that we're welcoming people back into the hospital. And number two, patient satisfaction with the virtual platform, video, is higher than in person in some instances. Wow. Now, we're a complex hospital. We have 55 subspecialties and centers of excellence from eye, brain, intensive care, heart and lung, digestive disease, transplantation, and cancer. And as you can imagine, all of those don't lend themselves equally to virtual platforms. But what's fascinating is that the ability to have a first interaction virtually is possible in almost all circumstances. And therefore, what patients need to know is that they no longer need to see insurance or distance as a barrier. They can have access to us at Cleveland Clinic Abu Dhabi and receive Cleveland Clinic care that's tied in globally from here to Ohio to Florida, Toronto, London, all via our virtual platform. So not only is there not a need to fly, but there's not even, let me put it in the positive, we now have access to 66,000 minds of the most cutting edge therapies anywhere, all via the phone. And we are leveraging this for the benefit of our patients more avidly every single day. Our virtual visits are increasing, our patient satisfaction is increasing, and the number of lives we can touch to protect them and get them to the right therapies are increasing. So we're very excited about this.
Dr. Suri, I think it's very interesting that you mentioned about the increased interest in the virtual services. And as a leading healthcare service provider in the world, I think this obviously technology, it has to be enabled by technology. Now, do you also believe that technology will play a much bigger role in helping you deliver the best of healthcare services, apart from the virtual services that we're talking about?
I'm very excited to speak on this point, Abhinav, because here at Cleveland Clinic Abu Dhabi, we have been empowered by our partners, the Department of Health, the Ministry of Health, the leadership of the Emirate and the nation to innovate quickly. Yeah. And this is fantastic because we don't have these in traditional healthcare environments. We don't have this endorsement. Now, number one, so the endorsement and the partnerships are there. Number two is the fact that we've been able to attract phenomenal talent. Innovators, not only in virtual and electronic platforms, but also artificial intelligence. So we have been able to deploy in a very real way. This is not just talking about artificial intelligence, but we've been able to deploy artificial intelligence algorithms, learning algorithms, right at the front door of the organization, meaning the virtual front door. When a patient calls, utilizing AI algorithms, we're able to determine which doctor or provider the patient needs to see. Number one. Number two, we can find them the quickest appointment available so that they get in as rapidly as possible. Number three, we're able to pre-screen them for insurance coverage and suitability of visit. And number four, on the back end, we're able to do things like reconcile the billing, deliver a final statement, and have pharmaceuticals delivered right to their doorstep.
Wow.
All with the integration on our one app, empowered by artificial intelligence and in a patient-centric manner, every step of the way from the virtual front door to when they're with us, if they come to us, to getting them the therapy that they need, whether that's pharmaceuticals or surgery or screening or even another appointment. So that's really the first time in modern medicine we've been able to do that. And again, COVID-19 and this pandemic has fast forwarded our digital journey, and we're delighted to be able to offer this right here, right now, today.
Absolutely. I think on a lighter note, there was this, since you mentioned, there was this meme about what has been the reason for your accelerated digital transformation journey. Is it your CEO, CIO, and people have been this COVID? So COVID, as you rightly mentioned, has accelerated the digital journey for a lot of organizations. And I think people see it as something good that has come out of this entire pandemic. And Dr. Suri, also, you mentioned about how you're looking at probably accelerating the digital journey for your organization. Now, could you elaborate a bit more on how do you see the Cleveland Clinic Abu Dhabi's digital transformation journey going forward, apart from some of the things that you just mentioned?
Much like other industries are imagining, we believe that that certain patients will be benefited by being served in the home. Not for safety reasons, but because it's best for them. So let me start by saying that we're delighted to report that today in the media it will come out that Cleveland Clinic Abu Dhabi is a COVID-free hospital. The leadership of the nation and the Emirate and our partners, the Department of Health and the Ministry of Health and others, other regulatory partners, have designated us as empowered to move ahead with full opening of our centers of excellence. Brain care for strokes, the most complex eye care anywhere, critical care in the intensive care unit, heart and vascular, digestive, the nation's only multi-organ transplant program, and cancer, cutting-edge cancer therapies that we even delivered as of last week. A new therapy called hyperthermic intraperitoneal chemotherapy, or HIPEC. These are all critically important because patients cannot no longer travel out of the country for this care, and nor should they when it's here. So my point is, digital transformation and touching people's lives so that they develop a web to feed into these centers of excellence will be fast forwarded and facilitated with our next steps moving forward. So previously we would rely on one clinician, one cardiologist referring to one heart surgeon, or a patient walking in if they were at the mall across the street. Now with this digital web of referrals that we have and the ability for patients to reach out digitally to find out the services we offer and to avail themselves of our Center of Excellence offerings, we are going to utilize our digital transformation journey to touch more patient lives. And that's not only in Abu Dhabi, that includes Dubai, Sharjah, Ras Al Khaimah, and even the region. So I see that as being fast-tracked. Let me just highlight a point you mentioned. You said, is it the CEO or the CIO? Our jobs as executives are to set a vision and a direction for the organization. What I want to highlight is our phenomenal caregivers are the ones that actually innovate, iterate, test, deploy, and continue to improve. And I guarantee you that we have 6,000 remarkable caregivers who have digital transformation at the front of their mind, and we will continue to march forward. So that again includes not only the front door of getting people to come to us, but also how we manage them when we're in a relationship with them as a medical provider and a patient. And finally, most importantly, people forget this. Once they have a high-end procedure or a surgery, they need care at home. And through Mubadala Healthcare, we are closely partnering with post-acute care, care in the home, digital monitoring through things like wearables, so that it all populates our electronic health record through Mubadala Healthcare and actually through the Department of Health through Abu Dhabi, so that we can ensure patients stay well once they receive the therapy that they need. So lots going on digitally.
Yes, I think the connected healthcare, as you spoke about, is a wonderful vision to have. And I'm sure with the progress this region, especially UAE and countries like UAE and Saudi Arabia have been making, that's not a distant dream, but a near possibility that we're looking at. So Dr. Suri, my last question to you is, what would your message be for the healthcare leaders across GCC who are watching this and who will be watching this later?
The message I have for everybody is as follows: to take a deep breath. There's lots to react to. There's news coming out by the minute. Some of it is good, much of it is scary, and other parts of it are negative. Yeah. As healthcare leaders, we have to remember that everybody's watching us. And our job is to instill calm, confidence, excellence, and a level of care for not only our patients, but the community and the nation. Yeah. Therefore, I would invite everyone to, in this moment of pause, focus on what the patient needs. Patients are scared. They're not sure of where this is going. They're worried about their families, their jobs, their ability to travel, etc. Let's be empathetic to them and design our systems in a way that we're collaborating through our regions, healthcare providers all collaborating together to give the patient the right care in the right way, at the right time, in the right location, in as simplified a manner as we can. And I believe digital transformation will help us. So that's the patient. Our caregivers, again, we need to focus on their well-being, not only them in the work, but in their homes and their families. Yeah. And finally, our organizations. We're blessed to be in a nation where the leadership are visionary and very proactive and decisive. And this has put us in a very safe and advanced position around the globe in dealing with and emerging from COVID. Let us collaborate together as healthcare providers through the nation and through the region, in fact, to ensure that we do things in a sustainable manner. So healthcare doesn't have to be massively expensive. It's only expensive when the wrong care is delivered in the wrong way, in the wrong location at the right time. We can flip that narrative. We can ensure that we work together to ensure that patients are screened at primary and secondary organizations and sent to a center of excellence institutions like we are at Cleveland Clinic Abu Dhabi to receive the most appropriate cutting edge center of excellence care for the specialties that I mentioned. Those would be the recommendations I'd have, and we're excited and willing and very, very ambitious to work together with everybody on this call to realize a new and broader future of healthcare for the region together.
Thank you so much, Dr. Suri. I think, thank you for your presence. I think it has been a wonderful discussion that I've had with you, and I'm sure the attendees have loved it as well. That's why I think we have the questions coming. And I'm quickly gonna take these two questions because I'm sure you would love to answer them as well. They're very important. Mr. Ramakrishnan Natarajan asks, can you shed some light, Dr. Suri, on how Cleveland Clinic Abu Dhabi is progressing towards remote robotic surgery and AI-based diagnosis? I think you gave us a hint about it, but could you let us know how you're progressing towards it?
Thank you, Abhinav. I'm a robotic surgeon, actually. So I spent the majority of my clinical career bringing in robotics into heart surgery and then performing these surgeries, teaching them and publishing on them. So I'm very passionate about this space. When we began robotics in heart surgery around the mid-2000s, the dream was always that we could practice these specialties remotely. In areas like heart surgery, it turns out that you need a bedside surgeon because when things go wrong, you need someone who's able to convert to open very, very quickly. In other types of surgery, that abdominal or others, where you have a little bit more of a time period that you could intervene if something goes off, I believe that robotics will continue to make progress in terms of distance therapy. And we might, in fact, deploy that here in the UAE. I see it deployed more locally than actually transcontinentally. There's really no reason when we've got world experts here in Abu Dhabi and in the UAE. So that's robotics. AI, very, very real. As I mentioned, this is phenomenal. The accelerated pace of development of AI, development of our app, and integration into our day-to-day work. You know, people love to get up on stages and speak about AI, and in many cases, it's a little bit of a futuristic vision. But I'm delighted to say that AI is very real and very embedded into everything that we do at Cleveland Clinic Abu Dhabi. So very, very excited to continue on that journey. Now that we're on it, we will never be off of it. It'll just get better and better and faster and more effective for our patients, our caregivers, and the organization.
I think that's a very positive message and a very progressive message as well, which brings me to the second question, which is asked by Mr. Osama Al-Hassan, who asks, how do you see the role of CIOs in developing e-health workforce, such as health informatics, telehealth specialists, etc., to boost digital transformation? So I believe he wants to ask, how do you see the role of CIOs supporting your vision in this digital transformation journey of your organization or in the healthcare sector in general?
We're very lucky at Cleveland Clinic Abu Dhabi. We've had world-renowned, fantastic CIOs since we opened. From Mike Regan to Gareth Goodyear, who's now in London, to Gareth Sherlock, who's now in London, and now Brian Lord. And Brian Lord, in the last era, since I've been CEO, we've really worked very, very closely together as thought partners to develop that vision and the clarity of thought about how to get there. And then his team have just been fantastic innovators to break it into bite-sized pieces and make it happen, deploy it, test it, and iterate it. So the partnership, I'm saying to your question, is a very, very important one. But here's the angle that I'd like to throw at that answer. I believe that we must keep the clinical context very close to the electronic solution, meaning you cannot develop these strategies alone in a warehouse far away from where the care is delivered. And this is what's so phenomenal about Brian Lord and his IT team, our CIO. They are embedded within Cleveland Clinic Abu Dhabi. They are on the wards, on the floors, in the operating rooms, developing what we do every single day. So I believe that's an important algorithm as we move forward.
Wonderful. One last question before we let you go for today, Dr. Suri, is from Mr. Sriram Vedula, and he's asked a very direct question. He's very direct, and he has asked that he would like to understand the IT function expectations in the near future from healthcare CEOs like you. So what are your expectations from IT leaders like him and the others?
Listen, I go back to what I just said. The partnership is key. Let me approach it from another angle. When our CIO, Brian Lord, sits at the executive table, he knows that he is not just a CIO. He has important insights to share in clinical care, research, education, and innovation. And therefore, it's important that Brian, as our CIO, not only sits at our executive team table, but is a part of the strategy development, the strategy iteration, and the execution. So I hope that's answering the question, but the CIO is an integral member of a modern, contemporary executive team of an academic medical center in 2020. I will never be at a leadership table without an electronics expert or a chief informatics officer.
I think that's a pretty big statement. And as you mentioned, that you would not be at a table without an electronics or an IT expert. And I think that gives a lot of confidence about the technology leaders in the healthcare sector, how it is going to play a key role in the future vision of healthcare leaders or organizations like yours. With that, I would like to thank you, Dr. Rakesh Suri. It's been an absolute pleasure having you with us. I'm sure all our attendees and the other healthcare leaders who are here have loved your interview as well. And once again, thank you so much. And you have a wonderful day, and keep doing what you're doing, keeping us all safe. And at the same time, please be safe yourself as well.
You too. Be safe. God bless to everyone. And we're always here to partner. Thank you.
Thank you so much. Thank you so much, Dr. Rakesh. It's a pleasure. That was Dr. Rakesh Suri, ladies and gentlemen, and it was a pleasure to have him with us. Now, we are going to move on to our next speaker for the day. Now, before we move to our next speaker for the day, it is only necessary and it only makes sense that we are able to showcase what our partners, because of whom we've been able to organize this, Nutanix, has been doing in the healthcare sector. And there is a small video that we would like to show to you guys. That was a short and sweet video for all of you all. With that, we move to our next presentation, which is going to be by Mr. Sebastian Dalias. Now, Mr. Sebastian is the EMEA Healthcare Director for Nutanix, and he has a 25 years background in the IT industry, with the last 15 focusing with passion on healthcare IT. Now, Sebastian balanced his career between the international roles at IT infrastructure providers and clinical software director positions at leading PACS and EMR companies. He achieved a data science degree from before joining Nutanix in 2018, since then looking after healthcare markets across Europe, Middle East, and Africa. Now, his engagements in GCC led him to patiently build a humble but growing wood oils and wood collection over time, which is wonderful. So, Sebastian, this is over to you, and you can take it away from here.
Thank you. Thank you very much, Abhinav, and thank you to Khaleej Times to offering us the opportunity to participate to this very good webinar. And to begin with, I think it's so much easier for me to be the third speaker after what we heard with the interaction with Mr. Hamza Batterjee and Dr. Rakesh Suri. And the reason why is my intention for the next 20 minutes is to reconnect a lot that has been said to the next part of the webinar, which is the panel discussion, and to share with you some of my findings traveling across Europe, Middle East, and Africa about what the challenges are and why do we have a need for digital transformation in the first place and what Nutanix can do about it. So it really starts with the why of why do we need digital transformation? And I think everybody is aware, even pre-COVID-19, that healthcare is a place where digital transformation is much required, because at least for this part of the world, I mean Europe, Middle East, and Africa, where we have public payers type of organization. We appreciate the way healthcare services is delivered, but the pressure of chronic diseases cost is causing a lot of pressure on the key KPIs, which are the quality of the outcome, quality of care, equality of access to healthcare services geographically and from a social perspective, but also what is the cost of healthcare as a percentage of the GDP of any given country. And that's pretty much a landscape that I tend to see everywhere. So fortunately, every country has come up with some kind of strategic plan to overcome the challenges and keep things under control and improve them. And even pre-COVID-19, we were seeing, I would say, two motions going on. The first one is the ever-flowing innovation from a medical and technical standpoint. There will, I believe, always be technical innovations in all the fields that supports healthcare, from medicine to robotics to new procedures to new applications. And this is actually pushing a deeper trend, which is the rise of better and better outcomes in every department, but also the rise of ambulatory medicine, and that in turn enables what is an even deeper transformation that Mr. Rakesh Suri touched in part of his comments, which is the reconnection or interconnection and coordination between all the care actors. So namely, as the hospital stays are getting shorter and shorter, there is a need to reconnect it with what happens before and after. So with primary care, social care, home care, and of course, empower the patient in the middle of all of this. And what we've seen happening since COVID-19 is, as our keynote speakers already said, quite an acceleration, pulling some of the stops against telemedicine that happened to be the norm in the past. Some of them have been pulled off, and we see there is acceleration there. We also see that work from home, which is not specific to healthcare IT, has been also happening a lot in the COVID-19, since COVID-19, and touches as well hospitals. And as we heard in the first keynote speech, the hospitals that were best prepared really took advantage of that. So it leads us to the point where we understand why there is a need for digital transformation. And this has to happen with every actor of the healthcare ecosystem, some of them being on the slide. And also at the intersection of their own businesses. So between primary care and healthcare, between the payer and national services and the providers, between pharmaceutical and medtech industry and the providers, etc. With the patients, of course, in the middle. And if we look at history of IT, healthcare IT is a pretty recent effort. I think it's fair to say that the acceleration really happened in the past 2, 3, 4 decades, depending on the countries. And this catch-up race ended up with a very good level of digitization of healthcare providers, processes, and biomedical data. And this is pretty much the prerequisite that we can build upon. We expect some kind of cloud transformation to happen in the healthcare space, pretty much the same way it happened everywhere else. Cloud revolution started 2 decades ago, and we expect it to transform healthcare as well. And we all understand the goodness of cloud as we are using mobile phones with apps in the cloud every day, and maybe we're using some cloud-enabled applications even in our institutions, our organizations. So we all understand the goodness of cloud. Problem is, it won't work for everything in healthcare. And I already put aside politics, sovereignty discussion, answering the question whether it's good or bad, to put protected healthcare information into cloud. So not for me to decide. But aside from this really big question, there are still some showstoppers that prevents the cloud revolution to happen at the same pace it does, or it did, in the finance industry and basically in every other industry. So to begin with, catching up with digitizing processes in hospitals ended up with way too many applications. In some businesses, one application does everything. But because we have these ever-flowing innovations in all the medical departments, there is no way one industrial software actor can really catch up with everything. So this is why and how healthcare IT evolved a building information system comprising way too many applications per hospital. I think this is one of the craziest ratio between IT staff and number of applications per institution. And if the top vendors will make it to the cloud and already offer some kind of software as a service, there is still a long tail of application vendors that will not make it, and reconnecting all the and interconnecting all the applications together requires an effort that still is in the hands of CIOs anyway. So first technical limitation of public clouds offering. A second area is network latency. Nowadays, radiologists are accustomed to get time to first image below 3 seconds when PACS are well implemented. And you cannot achieve that in the cloud, which I see every regional or national PACS for the biggest installations, which are so-called cloud enabled. In fact, just the archive is in the cloud, and you still have some kind of on-prem component, which is actually another PACS system within the hospital. And then, last but not least, you have the cost issues and the vendor lock-in issues, the governance issues, all things being equal. If your workloads are predictable, the cost effectiveness of cloud is, let's say, questionable. Cloud is really well suited for workloads where you cannot predict if the activity is going to be 10 times tomorrow morning bigger than the day before. So with all of this in mind, let's focus on how CIOs have been managing, this complex setup in the past decades up to now. And basically, we know that infrastructure investment schemes are planned for multiple years, typically 5 years, for example. And CIOs must, with the help of their staff and the rest of the hospital, figure out what the requirements will be for the next 5 years to budget things and plan for resources for staff and timeline accordingly. And that's pretty much a difficult exercise because CIOs do not have always the control about what kind of delays can be incurred by a department which is not happy with this module of the EHR, which jeopardizes the investment made at day one if the project is slowed for another 2 years, for example. CIOs have limited visibility on the roadmaps, so the future requirements of all existing applications for the next 5 years. It's not like software vendors, application vendors can publish 5 years in advance, you know, what kind of change in size of Oracle database, for example, they will end up with in year 3 or 4. It's not like that. Last but not least, CIO have limited control as well of the pace of renewal of medical imaging modalities and limited control on proliferation of other biomedical sources within the institution, like gene sequencing machine or other digitization machines that could transform medical insights into data. So with all that in mind, it's pretty difficult to figure out what the requirements will be for the next 5 years. And if we look again at both a functional view of what a hospital information system is made of, and also where the future implementing the digital transformation directions that we talked about just earlier, it's fair to say that the catch-up race for the past decades pretty much was an internal exercise digitizing processes, so administrative, clinical and diagnostic processes, and ending up with too many applications, most of the time requiring some kind of VDI, virtual desktop infrastructure as well, because the look and feel of the old electronic medical records, I know that there are new ones coming, but for the old ones, it's pretty much impossible to use it in a mobile situation without some kind of virtual desktop. So we have this on the one hand, we have the digitization of biomedical data on the other hand, which we just talked about. And basically the size of the IT staff, the timeline of the IT staff and the budget were really designed to support just this. And then the digital transformation moving forward is really more about interconnecting care actors together. So population health management, which also drives in a lot of countries, if not everywhere, a consolidation of hospitals together, as we see in UK with the NHS Trust, in France with GHT, in Saudi with the clusters, and the need to also expand the processes outside the walls of the institution, as it has been said already by our keynote speakers, so patient portals and so on. Pushing a lot of unknown security problems as if we didn't have any of them previously. And last but not least, once you turn digital, the things you've digitized on the left, so the internal processes and data, then you have a fantastic and unique and first time in history ability to give insight to research teams to tap into an existing data lake of actionable data for research. And this is, of course, a result of having a good job on what's on the left. Now, the key question is, if our budgets, teams, and thinking about time were designed to do a good job here, how can we do a good job over there on the right? And there are only two ways to do it. Either you add some more resources, which is really cool if you can do that. But with the cash constraint that we see in healthcare to keep systems under control, even more with the uncertainty of COVID-19, the other option would be to free up some resources on what we have on the left so that we can fund, fuel, and manage the projects on the right. And that's really what we expect from the efficiency that and the bite-sized computing that cloud enables. And this is exactly what Nutanix delivers with a twist. We deliver it by respecting the way your historical legacy information system was built. So we started on-prem. We help onboard all your application within a cloud that you start from within your institution. And from there, you have the freedom to expand it to other locations and to expand it to more workloads and more projects. So how do we do it? In a sense, what a cloud actually is, and the public cloud providers don't always tell that story, it's a software layer that makes hardware invisible. And at Nutanix, we started this journey a little bit more than 10 years ago now. This is the 10 years anniversary of the company. And what we did is we recreated pretty much the same kind of software that the big public cloud providers started for themselves, but we made it for you. So the idea is that with standard hardware and this software layer, you can actually instantly and scaling to infinity, instantly provision all the computational resources that you need to support your application, to build and run your application. So you need VMs, you need storage, you need network security, you need file storage, you need object storage maybe for some packs. You need to simplify operations over too many databases. You also need to enable work from home and VDI in an expandable way. You must also maybe think about scaling down when COVID-19 is over. You may also desire to streamline backup and make it as invisible as hardware is. And all of these are embedded services from within your enterprise cloud, which means that once you have a Nutanix cloud within your data center, not only can you expand it into the public cloud if you need to get extra horsepower to propel your new workloads, but also all the services we see here are already embedded. So you never need to install anything new, it's already there. So the kind of agility you gain from this, the kind of skill management, re-engineering you gain from this, and the financial benefit as well are tremendous. Not only do you get this unified scale-out operational and financial model as you would expect from a public cloud, except it runs with all your applications and you have control over it. So in a nutshell, it really helps, especially if you're in a merger situation where you need to decide how to organize the IT staff of the combined institution together. You need to manage the talent side. And with a kind of enterprise cloud, what you end up with is the capability from a single console to distribute roles for everybody to articulate the IT operations of all your facilities at once with a single tool to do everything. From a finance side, you don't need to overshoot, to overspend at day one like this crystal ball exercise required to do in the past. So right sizing is the new norm now. And if ever a project accelerates in an unexpected way, the bite-sized computing lets you play with CapEx and OpEx to grow your enterprise clouds as you see fit. Service level, pretty much a mandatory queue in healthcare, of course. I encourage that you visit the web and search for the Net Promoter Score of Nutanix. In the classic infrastructure we find in data centers, Net Promoter Scores are roughly around the 40s. And you really need to move into advanced technology in cloud to find scores like this. So what it translates into is if you contact existing customers of Nutanix, you will discover that there is no planned downtime anymore. There is excellent performance, and it really keeps CIOs at rest when it comes to being scared of a performance issue or downtime issue. And all combined, this is a great enabler to help transition from what we've built in the past and what we need to build or to accelerate in the future. And that's not only Nutanix saying that we've had a tremendous success over the 15,000 customers we have so far at Nutanix. 10% of them are actually healthcare providers. We achieved an engineering feat by getting, and we're the only cloud, whether on-prem or not on-prem, we're the only cloud provider that got certified by Epic from A to Z, including the operational database. And I know Epic is important in the region. The performance for PACS, for example, of our object storage service, which is again embedded, included in the cloud, in the on-prem enterprise cloud of Nutanix, is the fastest that Custream has tested so far. We have a lot of deliverables to prove the point, but that's also the industry saying. So all the analysts have found a leadership position from Nutanix, and IDC found and measured some key interesting metrics in terms of TCO ROI on Nutanix to further justify the move. So we also have something which is quite unique that my team have set up. I think we're the only infrastructure provider so far to have built demo capabilities that we can deliver to you anytime, that actually run an actual EMR and an actual PAC system, so that we could, by listening to our customers, recreate the use cases that are the traditional challenges we see in hospitals, that one hospital that needs to merge with another, a PACS that needs to grow because of new availability, a performance issue at 10 a.m. On the EMR, how you remediate the things. We prove with our demos, by launching the clinical apps themselves and using our technology, we prove how life is better and simpler with Nutanix than it is with any other kind of system. And of course, we can connect you with our growing base of customers. I'm pretty sure we are going to find a customer that face similar challenges as you. And we invested a lot in GCC. We have teams everywhere in the GCC and a lot of really good partners to support your challenges. So that's it for me. And again, thank you, Khaleej Times. Thank you to everybody today. I think unless we have questions specific to this presentation, we can move now to the panel discussion.
Thank you, Sebastian. Thank you, Sebastian. I think we have a couple of questions specific to this presentation, and we would like to very quickly take this, and probably then your team can discuss this with them offline as well. So the first question is from Mr. Fahimuddin Khan, who asks, adapting cloud computing in healthcare, is it not challenging, like security concerns, risking patient information, local authorities compliance?
Okay, yeah, that's why starting on-prem is a good idea. You don't change anything security-wise. You actually harden the security by starting a cloud on-prem. So you still have 100% control of it. There is nothing outside your reach and control if you build it with your data center. What you do after that, expanding it to public clouds, if you want to do so, is your decision. But it has to start from within the institution, within the hospital.
So, and Badal Motwani asks, I would like to know and understand the IT security function expectations in the near future from healthcare organizations.
Right. So it's a complex and wide question. I would only quote, I would say, two things. First, something that was already there. We still need to make sure we can recover data to a very recent point where we have trust that data was not compromised. So that's one area, and it's around the ability to detect anomalies. We have features to detect bad usage of access to files, for example, and then remediate to reverting to a point in time where we know for a fact that data was not compromised, and that's the job of data protection things and that we do with backup solutions and snapshots and so on in disaster recovery. Another area is when you build multi-site facility in a non-virtual world, you would use firewall for everything. But in a virtual world, firewalls are really a pain because of the static nature of how you decide what is enabled and not enabled. So we actually designed software-defined networking to help protect the flow of data that connects facilities all together in a very nice embedded way. And again, this is industry unique. You don't have to install anything. As long as you already have Nutanix, it's already there, and you can turn that feature on and secure the flows of information in between your different facilities. So those are already two aspects, but there are so many more.
With that, I would like to thank you, Sebastian, for the wonderful presentation. And I'm sure from the questions that we see coming, there's a lot of interest, and hopefully your team would be able to answer that for them after this webinar. And we would like you to stay on, hold on, as we start our next panel discussion. With that, I would like to invite our other panelists for the day, right? And our panelists, just a second, I'm gonna, share the screen. Perfect. Yeah. So our next panel discussion is on connected healthcare infrastructure, driving systematic transformation post-pandemic. And with that, I would like to invite our panelists. You all have already met Mr. Hamza Sobi Batterjee, who is the president of HSB Holding. We would also like to welcome Engineer Abdulaziz Al-Khalaif, who is the CIO of the Al-Mishari Hospital group in Saudi Arabia. Engineer Abdulaziz is a veteran of 23 years, working in the IT and information management field with 13 years in the HIT. The latest challenges he took over are implementing ERP and HIS system for hospitals in various stages of operation. He has worked on the logistics and the architect of the system delivery that suits the organization's objectives, right? Keeping current and update he's updated with the latest technologies and with e-learning and online content, and contributing and being a member of the local international interest groups and institutions. He's been working with local and big brand names and solution providers together to help fulfill the goal of digital transformation for his hospitals. Welcome, Engineer Abdulaziz. It is an absolute pleasure to have you. Our next panelist is Rani Uday, who is the Director of the IT Infrastructure Division for ATC Kuwait, a skilled and internationally experienced IT leader with an outstanding testimony of success planning and delivering multi-million projects in challenging healthcare environments. Pioneering and commercially perceptive, offering robust business leadership and excellent influencing skills, creating lucrative alliances and relationships. I think influencing skills are definitely needed. Rani is also the director of the IT Infrastructure Division in ATC. His experience includes more than 15 years developing and operating enterprise IT infrastructure solutions, as well as support for the company's enterprise customers, spanning several verticals like healthcare and telecommunication. So welcome, Rani. It's a pleasure to have you on board with us. Our next panelist for the day is Raziel Pena, who takes care of the entire ICT operations for MediClinic in the Middle East. Raziel is currently serving as the ICT operations manager for MediClinic Middle East and has been part of the group since 2015, experiencing the group's transformation and growth through the UAE. He leads the efforts to provide excellent customer service while introducing new technologies, supporting the company's digital transformation journey, and tackling the technological challenges that come with such a dynamic and changing environment. Welcome, Raziel. It's a pleasure to have you with us. And also we have Sebastian and Abu Hoof, who have been with us from the start. So welcome all the panelists, and to the ones who've already been a part of the discussion from the start. Welcome back. And to the ones like Engineer Abdulaziz and Rani and Raziel, welcome to the panel discussion, to the webinar, and thank you for being a part of this.
Thank you.
Thank you very much.
Wonderful. So we're going to start asking Engineer Abdulaziz, asking Rani, and asking Raziel, how are you guys doing? How is your family? I hope everyone is safe.
Yeah, absolutely. Everything good. I'm working with the whole situation, but thankfully everybody's healthy.
Wonderful.
Yeah.
Wonderful. Engineer Abdulaziz, for you. I'm sorry, we're not able to hear you. I think.
Saying that we are safe, alhamdulillah, and we are keeping
Wonderful.
our family and our workforce in the best safe situation within our hands. Thank you for asking.
Wonderful. Thank you. And Rani, welcome. I hope you're safe and your family members are safe as well.
Thank you, Abhinav. Actually, yes, we've been during in Kuwait, especially as we located, we've been locked down the whole country for the last, I would say, 2 to 3 months now, but everybody's safe. But because of the business nature, as for the company, we work on the healthcare and we are a healthcare service provider. So we've been working like, I would say, 24/7 in the previous months. So doing great. Thank you for your question.
And I think that's been the situation with all the leaders and professionals in the healthcare sector. They have been on call 24/7. And we would like to congratulate you and our deepest appreciation you guys have been doing. So congratulations on that as well. And we're going to start with the first question, which is to all the panelists. In light of the global pandemic, how important role do you think connected healthcare driven by technology will play in contact tracing? And we would like to start with the ones who've just joined us, Engineer Abdulaziz, Rani, and the others, also Raziel. So Engineer Abdulaziz, can we start with you? And what do you think the role of connected healthcare driven by technology will play in contact tracing?
Well, over the last 3 months, we've seen a grown interest into connected health. People like to get the service in convenient. They like to keep it safe, and they are also open to the idea of that receiving that care should not be done into the traditional methods. So they are open to receiving this call over the telephone, over the virtual meeting, or any other devices that could be, available for that task. So that openness, that way of receiving all of those, services is open a whole new field of, interaction between the care providers and the care seekers. So I see tremendous opportunity coming in the future for access of care for those even within the modern city or in the rare area. I'm very hopeful for the future, even though pandemic like COVID-19 have really shown us what is the society need to be and what they need to react on. But it does open a new opportunity for change on a larger scale. Thank you.
Thank you, Engineer Abdulaziz. Rani, would you like to add to that?
Actually, I would complement what Mr. Abdulaziz mentioned. The connected healthcare now became the core of the business in all the countries and even worldwide. So from the experience in Kuwait, I would say specifically, usually a connected healthcare could be into 2 parts. First part is the infrastructure and the integration between the different and connectivity definitely, where we have to have a proper fixed infrastructure to adopt any other technology or application when it comes to the reality for instance, such this pandemic, when you need to have, I'll give you an example here in Kuwait, in the Ministry of Health, we implemented a huge infrastructure connecting all the government's hospitals, being general hospitals, primary care, polyclinics, specialty hospitals, and all those connected in a centralized infrastructure and replicated to a DR across the country. So this is from the infrastructure perspective. And by the way, this was implemented with the Nutanix, thanks to the hyperconverged technology. It was a huge benefit for scalability and easily adopted and minimize the time, as Sebastian mentioned in his presentation, when it comes to adopt a new technology and application. Now, from the application perspective, because of this pandemic, we had the Ministry of Health decided to especially for the contact tracing, decided to have an application to come out with the results, a decision supporting tool for the Ministry of Health and for the leaders to decide on everything related to this pandemic. And this application was developed. We worked on this for in 1 month time, and we deployed it immediately because the infrastructure was scalable and ready to be implemented. The application in Kuwait, they call it here Assur. It was mainly contains of 2 components, which is the healthcare facilities, first thing, and the public. The healthcare facilities, it's about related to the ventilators, the ICU, beds, doctors, nurses, all the assets within the different hospitals within Kuwait. And the other part is the public, the PUI, person under investigation. And this is where the contact tracing was very important here to track everything from the different quarantine areas to the different hospitals where the COVID cases was active, plus to know for the decision makers, the minister and the undersecretary, they can know, okay, in area A, for example, or hospital X, number of doctors is less, so he can transfer from one location to another. Number of ventilators. So contact tracing was very important, also to do the swipes for extra number of patients. And I think during the connected health that was provided there, that made it easier to Ministry of Health of Kuwait to implement and roll out an application within a month time, starting from the day of the lockdown here in the country.
Okay, wonderful. Gentlemen, just before we continue, I just want to add something. I think we have a range of questions that we're going to ask, and we want to ensure that we cover as many questions as possible. So what I'm going to do is I'm going to ask a different set of questions to different panelists. And if the ones who, apart from the ones I've asked, have any point to add to that, they probably can add in between. This way, what we'll be able to do is cover the maximum amount of questions for this panel discussion as well. Thank you so much, Rani, for this. Moving on to Mr. Hamza for our next set of question is that, Mr. Hamza, one question that has always popped up when we talk about IT in healthcare is why can't healthcare be like finance, retail, or any other industry that uses data to their advantage? Now, we've seen how BFSI sector, the banking financial services sector, has transformed using data at the core of their technology strategy, and also the importance of a secure infrastructure to run these big data analytics. So why do you think the healthcare sector can't be like that?
As I said earlier, that in other industries are doing better than healthcare. For example, like the airlines, which I have earlier spoke about, for example, they have the passenger name record, where we do not have that in the healthcare, but we tend to do that. Secure infrastructure is critically important for government and private alike. There are 5 very important points in securing the infrastructure. So what I suggest is, for example, conducting cyber security awareness training, that's for sure. Firewall architectures, ensuring you have endpoints protection across all devices, ensuring end users devices like mobile devices, for example. Security policies, procedures are updated and followed. Risk assessments, for sure, that you will be able to have a better cybersecurity. Asset identifications, that is more that will help to secure the infrastructure and to run big data analytics.
And thank you for that. Razil, would you like to add anything to that on why, despite having so much of data available in the healthcare sector, why the use has not been on par on when you talk about the other industries like the banking industry as well?
Yeah, I think, or I would not like to say that that is not as good. I think, of course, the challenge is bigger than other industries. And I will say the biggest questions are, what do we share and with who, right? Because there are a lot of efforts, for example, sharing some data with research institutions, with the schools, with pharmaceuticals that use all the data sets that we could provide for them to come up with better treatments, better drugs, etc. So that is happening. Now, the problem that every healthcare institution faces is that, like, who do we share the information with? How do we do it? What is allowed? And you need to have a balance in between what the guidelines for the country you operate in are. So you have to be careful with that, and also be careful with the details that I shared, and make
Absolutely.
sure that the patients and the people that goes there are agree with that. And then, of course, that goes in hand to hand with what you need in terms of the technical side of all the security, all the security layers that you have to ensure that data is protected.
So very quickly, I would like to ask Sebastian. Sebastian, if you could very quickly add to this, because the reason I'm asking you specifically is that you have been on both the sides, right? From the end user point of view and as a solution provider. So why do you think it is the case of what we mentioned about the use of data in the healthcare industry?
I think another angle to this is because every other business started their digital journey before, and you can only actionate data digitally if it's digitally available. So because the digital journey of hospitals started after banking, finance was quoted. Finance started 70 years ago, maybe sometimes even a century ago with the birth of IT, actually. So that's another angle to it.
Wonderful. Moving to our next question, and this I would like to categorically direct towards Engineer Abdulaziz and Mr. Hamza, starting with Engineer Abdulaziz, is that Engineer, the healthcare obviously has been the hero in this fight against COVID, but it has also brought to light that how a lot of more investment is in healthcare is needed, and what we see, and we see that coming post-COVID. Now, how much of this investment post-pandemic, when governments and organizations are spending to ramp up their healthcare service capabilities, how much of it do you think should be invested in technology, and how much of you think will be invested in technology? I'm sorry, your voice is not audible, Engineer Abdulaziz.
Touch again. Hello? It's gonna be a tricky approach here, because technology does not float on its own. It does have legs on the resources and human and society. So you might begin by pushing a lot of investment inside the health sector IT side, but you will end up pushing some of those investment into changing the behavior of people, changing the tools and the environment that they're working in as well. Technologies seem to be lacking when we are talking about healthcare, just because it was not up to the task. It was, designed and built for those sitting on a desk in an office. But the healthcare workers do not do that. Majority of their time are spent moving around, catering for care. So we need to wrap our head that we need to adapt to their need. That's not the way around. So again, on your question is, I think investment need to be pushed, but it needs to be distributed between actual investment in technology and investment in those people, in those workforce.
Absolutely. I think what you mentioned is absolutely right, that it needs to be distributed as well. Mr. Hamza, I would like you to come in over here because you can speak from both point of view, as an investor and also as a technology leader. So what do you think, how much do you think should be invested in technology, and how much do you think realistically will come to technology when you see healthcare companies ramping up their operations and services after the pandemic?
I think the healthcare industry have shown a great responsibility towards the COVID. I think investing in IT is, as I said, is an ocean. But there are many areas that companies can invest. For example, in remote patient monitoring, using the IoT, which Dr. Rakesh referred towards, which is the Internet of Medical Things.
Yeah.
Going towards paperless environment, integrated systems, integrated having your HIMS, for example, focus on that, focus on certifications. Try to prioritize your investments toward getting into international standards before getting into innovation. So how about you go into the main principles, then towards innovation. So HIS, for example, HIM certifications and others are very important. As we said, telemedicine and others. In terms of investments for the healthcare, it depends on the budgets, of course, of the healthcare, but and it depends on the maturity of the IT within the organizations. As I said earlier, there is a technology disruption, and if organizations and I feel that IT would actually grow in the future, and you would be having chief artificial intelligence officer, you would be having the chief machine learning officer, for example, you would have chief blockchain, etc. So what I think, and I personally think, that if organizations or healthcare providers feel that they would have such team within their IT department, I think that is not a great approach. And I think the future approach is to outsource IT and have the healthcare providers focus on their medical forte and not go into IT, because IT is growing very rapidly, and especially healthcare IT. Why? Because patients have been more aware and patients want more. And in order for you to give more, you need to invest more in IT. And in order for you to do that, then you need to have a lot of caliber that you need to be hiring in your IT department, which I think you should be focusing towards outsourcing the IT department and having clear deliverables and focusing, of course, on the main foundations, and then going towards innovation in IT and AI and AI platforms and so on.
Thank you. Razia, would you like to quickly add in over here from your point of view, because you also handle the ICT operations? So what are your expectations, and what do you think you're really going to get from the budget? I think you're muted, so you'll have to unmute. Oh, okay, I'll just. Yeah.
Sorry about that. Saying that that's always an interesting conversation to have with the finance department and the people around. I think maybe what we need to concentrate is to make sure that the investment, whatever that is, whatever the amount of money is actually smart, looking at the future. Make sure that those solutions are actually geared towards the problems we have now, and trying to look into what's coming, right? Unfortunately, the situation was quite sudden, even when we had some warnings from some people. I'm sure everybody saw those presentations in the past from people like Bill Gates, etc. So I'm sure we want to be in a situation like this in the future. So the better prepared we are, the better. And that means we need to look at the money we spend right now. It's aimed to fix the problems we're facing at the moment, and also getting us towards a readiness for a similar situation in the future.
Okay, wonderful. Coming to the next question, and I would like to start this with Mohammed Hof. I think you would be the right person to start with, because you obviously cater to clients across the geography. Is that apart from the patient services and technology's role in it, there's also the need to, as we know, to have smart and integrated systems to reduce the administrative burden, right? Now, where do you think, from your perspective, and also because Nutanix is a global player, where do you think the GCC stands when it comes to using technology and smart and integrated systems to reduce the administrative burden? Hope if you could probably give views on this.
Sorry, Abhinav, can you repeat the question? Apologies for that.
Yeah, so I was just saying that, while we all know that the role of technology in patient services, we also know that there is a need to have smart and integrated systems to reduce the administrative burden, right, for the healthcare companies. Now, where do you think the GCC stands when it comes to that? And the reason why I'm asking you, and move on to Sebastian Rani also, is because you guys cater to a lot of clients, and also Nutanix is a global company, so you would be able to give a perspective in terms of comparison. So starting with you, Hof.
Thank you so much, Abhinav. Yes, agree with you. It's the administration part today for technology and IT is really time consuming, and this is where our customers are really suffering the most, having the most of their skill sets built around just keeping the lights on, having many people dedicated for certain environments just to keep the lights on, and this is where most of our customers are at this stage now. Many of our customers started the transformational journey now. For the past couple of years, they start considering this, and they started this journey into moving into more autonomous operation, what we call autonomous operations when it comes to the infrastructure, to drop and get rid of that load on their team and keep their focus on the business, on the applications, and on the patients as well in the healthcare industry. So this is something, it wasn't doable 5 years ago. Automation was costing actually hassle and money 5 years ago, more than having the people on ground to run. Today, it all goes back always to the financials. Today, automation is built in Nutanix technology in specific, it's built in. It doesn't cost too much of time to implement. It doesn't cost you much of money to maintain and build. So, and it relieves our customers big time. So we have just to give you an example, we have one of the big environments here in the kingdom, in Saudi, that is running thousands of schools, let's say, run by two guys only. One girl and one engineer, and the second is a girl engineer. They've been doing an amazing job maintaining thousands of schools by themselves, and this is where transformation really takes place.
Rani, over to you.
Okay, I would like to answer this question as for the integrated systems. Actually, I would say there is two parts of this: the integrated systems from infrastructure perspective, and the integrated systems and solutions from application perspective. Now, definitely, the burden will be reduced for any organization or healthcare facility or government if it comes to the infrastructure. With having centralized infrastructure, will minimize the cost, will minimize the administrative headache and extra cost required here to maintain and support and so on. Now, from the application perspective, and it's also, this is linked to the previous question you mentioned, I think here we are talking about the healthcare sector, and when you want to integrate different systems, for example, the LIS, the Lab Information System, Radiology Information System, the hospital information system, interconnecting and exchanging data between those different systems, it's a quite difficult. I would say in the GCC still we are not the maturity level, even in the world actually, not only the GCC. The HIE here would be the umbrella to interconnect between the different applications. For example, I would say a very, the leaders in this, and they started the exercise, I would say 2 years maybe back, Malafi in Saudi Arabia and Sahha and Malafi in Abu Dhabi and Saudi Arabia. They've been working on HIE implementation for the previous 2 years, maybe 1.5, 2 years. And I know that it's working now, but still it's a costly and timely exercise. So as I said, from an infrastructure perspective, definitely there is a reduction in the cost and from the administrative burden. But when it comes to the application level and having the integration and interconnecting different applications and HISs or other applications in the healthcare, it would be a bit difficult. Now, from another software perspective, I know in the GCC, we partnered with MOH to roll out a drug registration software that all GCC countries have agreed to implement as part of unifying the drug registration process across the GCC. So this is one of the things that, but this is a specific application, not for all the different healthcare applications. Thank you.
Thank you, Ronnie. Sebastian, if you could very quickly add into the question and your point of view as well.
Simple one. I know a lot of hospitals, and I'm not talking specifically in GCC, more in Europe, where the administrative staff is up to 35% of the global staff, which means you have 1/3 of people not taking care of patients. And that's the result of not implementing all the applications that you need to take care of the paperwork, basically, which is the role of IT. And the reason why they haven't done so is because they take as an excuse that keeping the lights on of everything they already need to run IT-wise is already taking all of their resources, and that's it. So anything we can do to simplify operations and free up resources to fuel new projects like, to kill this administrative burden is of course absolutely necessary.
Thank you so much. I think a follow-up question to this, which would be more relevant, asking our end users, and starting with you, Mr. Hamza, is that what, according to you, what departments do you think after the pandemic, when we start the process again or continue the process of digital transformation, now what do you think as a CIO, which department will require your attention on a priority and why?
I think the priorities would be in departments, for example, like the HIS department, the Hospital Information System department. As I said, moving towards HIMSS certifications, of course, and that would definitely help the hospital to really shape itself. And to really focus on the patient-centric, but also to get other areas more efficient. Of course, the supply chain has a lot of that requires cost optimizing solutions, which are very, very important. Introducing new technologies that save costs. Business automations across multiple divisions, new working ways, working from home, models, improve efficiency, introducing business intelligence solutions, powering of the healthcare service. So command centers to provide clear dashboards for the management.
Thank you. Engineer Abdulaziz, if you would like to let us know on what department would be your focus in terms of when you get back to focusing on the growth plan as a CIO once again, I believe, because as of now, the focus is on probably making sure that the infrastructure supports the current COVID operations. But once you get back to what you were doing before the pandemic, what departments would be your focus? And has your vision changed on what it was before the pandemic, or is it still the same?
Well, it's still the same. Thankfully, we did our
I'm sorry.
due
I'm sorry to
diligence.
interrupt you, Engineer Abdulaziz. You'll have to probably hold the mic a bit closer.
Yeah, I
Yeah,
am
this is
holding
perfect.
it so
Perfect.
closer.
Perfect.
So hopefully that our vision, our strategy is on the mark. Here at Al Mishari Hospital, we did our due diligence. So we predicted a little bit in the future that automation, as our colleague has been saying, automation and smart use of the technology and seamless use of technology is one of the top priority that we have. So making sure that the work or the burden on our care provider are reduced is also one of our biggest objective in the future, because we understand for them to do their job at ease, we need to seamlessly put those technology in place to automate their processes and do not burden them for working extra just to implement additional system in place. These systems, as been mentioned before, are coming under standard like HIMSS standard or any other body that we are implementing in the region. Now, those systems and standards are here for a reason. Those reasons are to reduce the effort, to make sure that multidisciplinary or interdisciplinary teams are aware about the situation. Safety of our patient are one of the toughest priority that we have in Al Mishari, and I'm sure all other hospital caring for patient. I think we are still going to our original strategic vision of empowering our care provider with seamless use of technology wherever we can. Thank you.
Sorry, Razil, would you like to quickly add into this point over here as well on what your focus do you think would be after the pandemic, or which areas of your organization?
I think I will agree here with what Mr. Rani was mentioning in the two areas, one in the infrastructure part and then the application. So of course now in the infrastructure part, to make sure that we optimize usage, we reduce waste, we use all these new capabilities that we could have with the cloud solutions, while at the same time making sure everything stays secure and accessible for everybody. So that's definitely one of the efforts that department should be putting a lot of attention to. And now on the application side, I think the core, or making sure that the core application has a very robust layers for integration, because as we move along, we bring new stuff, we bring new applications, we bring new devices. You want to make sure that everybody talks to, everything talks to everything, right? And you can leverage that information, add it into your main system, maybe use it for other purposes within the organization. So those two right now are key.
So thank you for that, Razil. And the next question I'm going to start with you again is now we have come to know that there is a very strong focus on organizations after this pandemic, and with the sole concept of social distancing and all of that being in place, there will be a major focus on segmenting and prioritizing patients, which we also believe would be the need of the future. Now, do you think first a CIO should be leading this initiative? And if yes, what are your thoughts on it?
Well, I think absolutely. I mean, the CIO is key part of the organization to lead all these projects. I'm really happy to, from what I heard from Dr. Suri, honestly, hearing those words about heavy dependent and the partnership with the CIO to make sure that all the innovations and everything that the organizations wants to do to improve the patient care it's paramount, right? I think that that's the right word, the partnership between the business and IT. Also, going from what Mr. Hamza was saying, like, yes, IT should be the driver, of course, but going one step ahead, be the partner with the business. And definitely that starts with the CIO, who sits with the other executives. They set the strategy clear, and then they set it to the rest of the team. I also would like to think that should be extended to everybody in the IT organization. Not and it should not only stay at the CIO level, but everybody from the CIO to the guys on the ground, make sure that they are seen as partners to the business. From the doctors and nurses, that they know that they are there to assist and also to contribute with ideas. Honestly, we had every now and then we welcome ideas in our organization from everybody, from all the employees at every levels, and you will be surprised. There are many ideas to optimize things, to get new stuff in, and that comes from people on the ground. Yeah. So definitely it starts with the CIO and needs to be replicated across.
Thank you. Mr. Hamza, do you agree with that this is something that the CIO should be leading? And in terms of when you think about implementing a system of segmenting and prioritizing your patients, keeping the future needs of social distancing and all of that in mind?
Yes, absolutely. And actually, that was your previous question in the contact tracing question.
Yes.
There are multiple ways over there, like population health, which is big data, where you can get the tracing of the pandemics. Like a government of Saudi Arabia have done multiple solutions in the self-reporting and also in the automation. It was done by the Saudi Data and AI Authority. Solutions like Tabaud and Tawakkalna to their solutions in Saudi. I would like to highlight, there was a question asked by Sivaram.
Yes, please.
Yes. She asked about how to do process automation within the departments of clinical HR and so on, and how to include the stakeholders. So how do you do that? Is basically you get the stakeholders in and you do process mapping, and then you engage partners, system integrators that have robotic process automations that can be able to streamline these processes, and actually that would be a reduction of a lot of manpower and increasing the efficiency. I hope I have answered your question, Sivaram.
I think so. You have, and if not, he'll let us know shortly. Engineer Abdulaziz, I'd like to bring you in over here and would like to ask you is that, are you, same question, but different words, are you also looking at probably a possibility in the future where you would have an initiative about segmenting and prioritizing patients who come to your hospital?
Again, catering for the need of the patient is the one top priority that we are seeing. Now, extending care to the location of the patient, having that moment, identify where is the patient going to interact with the care providers or the care services, or needed those type of allied health or any other consultation. Those are the moments that we are trying to segment our patient in, so we could cater for those different type of interaction with different type of technology delivery. Now, when you're talking about delivery, you're talking about you are going to the patient. You are not bringing the patient to you. That's what the whole change that we are seeing. The movement is that we need to inject ourselves inside the daily life of those patients. We need to interact with them in their level and their understanding. We need to adopt their way of understanding of how things need to be done. Now, customer and patient are merging together into one word. They are our client. We are dealing with their need, and we are adjusting our own structure around that very important person is the client.
Yeah. Thank you so much for that. The next question I was going to start asking with you again, but I think I would like to bring in Rani over here, is that, well, obviously, my question was that how do you as a technology leader, I was going to ask Mr. Hamza, Engineer Abdulaziz, and Raziel, as how you as a technology leader find the right balance between security, compliance, and mobility with your enterprise cloud. But I would like to start from you as how do solution providers help the CIOs achieve that? Rani,
Yeah, so we are talking all about how do you find the right balance between security compliance and mobility with enterprise cloud. I would look at it from, it's a generic question, I would say, but look at it from the traditional on-premise infra used to be gives the best control over security. Now, currently what's going on, the required mobility, it's a must now for all the applications, and I think there is an echo. Yeah. So now the mobility came on. With the mobility, the traditional infrastructure would not work much. So it's moving more into the cloud. And the cloud infrastructure now is reliable, secure, and required everywhere. Now we have definitely the well-known cloud providers in the market, like Microsoft, like Azure, AWS. There is now the compliance part. What I see that in some of the countries here in the region, when we talk about implementing any solution related to the patient data, it's the compliance here where control that you cannot go in a public cloud across to have the data outside the geographical location of the particular country. Like, I think this is applicable here in the GCC. Like, will not accept the data of Kuwait to go outside Kuwait. Yeah. So here the need came to a private cloud where it can be implemented through technology partners like Nutanix and others.
Mohammed, Hof, would you like to step in over here and probably let us know on how do you think as solution providers you help the CIOs achieve a perfect, not a perfect, a right balance between security, compliance, and mobility with the enterprise cloud?
Absolutely. See, it's first of all, building the unified approach and building unified infrastructure will make it much easier for all the customers. Then start building on top of that, where security is part of the policies, applying security policies, unifying the security policies, keeping that under a blueprint where you can reuse that and reapply the security policies is helping our customers in automating this process of auto hardening even, and not to wait for vulnerabilities to take place. So we do have this in technology today, the blueprints layers, which can help in application lifecycle management and applying unique security policies and reuse these security policies all the time. That is something part of the technology today. It makes your life easier. It's built in.
Sebastian, any thoughts from you on this?
Yeah, I think there is no compromise between security and mobility because you basically need both. So that's not something we can compromise on. Compliance has been discussed by Rani already. But I would say that how do you manage security in a world where mobility is and hackers and malware is by design? Actually, your IT system needs to react just like your immune system. So what does your immune system do? They detect malware, they detect attacks as early as possible, and then they remediate it, and they try to revert your body afterwards to a point where you're comfortable. And this is exactly what security is all about these days. There is no level of defense or walls you can build to interact potentiality of any kind of attack. So that's something which is way, way easier to build with Nutanix.
Engineer Abdulaziz is smiling, so I think he has something to say over here.
Yeah, I do agree with my colleague on all those points. You know, having a regulatory body start the umbrella for us to uphold, to govern, and then from each organization, with the help of the partner in technology, reduce that service of attack. When you're dealing with those sensitive information, you have to put on your mind, and every step of the way is to reduce the service of attack. Now, no, the point just raised a few minutes ago is that once you are hit, you need to recover. As a body, you need to know how to recover. You need to have at least a strategy how to go back to normal business. And now that is a huge important, because you'll never cater for every type of attack, every type of security breach. You have to have those strategic way or strategy to go back to normal operation. That's what I was smiling, because no matter what you do, you will always be vulnerable. There will be
Absolutely.
clever people trying to sabotage your work.
Absolutely. I think that's a very valid point. We have a question from the audience and from Mr. Sharif Imam, who asks how to take the maximum benefits of IoT and 5G in healthcare, as they are a trend right now. Reziel, would you like to answer that? And we'll move to Mr. Hamza after that.
Sure. I actually I saw the question and I saw it quite interesting because I remember a video demonstration that I saw some time ago of this pilot that they were thinking in, I believe was in Finland, that takes full advantage of the amount of data that can be transferred with 5G networks, amount of data and the speed of that transfer. And I think this example shows what can happen, right? So in the video, they have this couple, the husband falls down. It seems that he's having a heart attack. The wife is able to with an application, right, from the healthcare provider, they can record that video. The application itself will give some instructions. It will call immediately the emergency services and start providing some other information. While the ambulance comes, then they start with the first care at the site, and then on the way to the hospital, they are able to record all the vitals of the patient, and they're sending them real time to the hospital. By the time this patient arrives to the hospital, the whole team there in the emergency department, they are fully ready with what this patient needs, right? There's no more delay in communication. There's no need to start these questions to the paramedics, etc. So it's all seamless, right? And they are able to do that because of the amount of data that we will be able to transfer. Now, this may be a very logical step. I think we will be very surprised when people start getting creative and start getting other uses for this kind of benefits.
Absolutely. Mr. Hamza, would you like to add on how do you think, how to take the most benefits out of concepts like IoT and 5G in healthcare?
Sorry. Yeah. Can you hear me?
Yeah.
I agree with Raziel, my colleague, what he just mentioned, but also in the IoT, the new future is IOMT. So it's Internet of Medical Things. So Internet of Medical Things is you get these wearables, these devices, and of course, you will have many indicators on the mobile applications. You can integrate them with the screens within the premises, and you would actually be predicting what the patient.
Engineer Abdulaziz, would you like to add to this as well?
Approaching a very interesting time. Once you have the technology in the hand of those innovators, when you have that simple technology of connecting any type of device to a bigger grid of network, and then driving use from that,
that will when we have real innovation. Now, these technology are merely very cheap to implement. So I'm really looking forward to have those small interface devices that we could have, and then bridge the old technology with the new technology. We need to see those type of small, cheap to run devices. I remember a long time ago, a while ago, not that much long. It's like safety of the infants and their mother, and then deducting of the infant in the hospital was a big issue. And for that time, 10 years ago, it was a hassle just to have that technology in place. Right now, it's very easy to imagine having that technology in wearable, but in cheap wearable that is going to be catering for a real situation that the hospital and the healthcare needs. Now, that is said, has been said, but again, we need to look at making sure those devices are into a standard, making sure that those devices are able to be upgradable and patch on the air. Those are some of the missing, issues or problem that we see right now in IoT devices, because they are very small. You don't have that much facility of the iOS. Uh, that's what my take on the IoT issue.
Thank you so much, Engineer Abdulaziz, and thank you to all our panelists who've joined us today. Everyone, I think you've made some very interesting points, and I think from the interaction that we've seen, that from the questions that we've seen, I would also like to believe that our discussion was on the right track, and this at least would help the CIOs and the technology leaders in the healthcare industry to probably speeden up, or at least right from involving their stakeholders to speeden up the process of the digital transformation of the use of technology for the to meet the future vision. I think this would really help them get some key takeaways that they could go back and implement it within their organizations. We would also love if we have any questions that comes from the attendees after this webinar, we would redirect it to you for a proper conversation of a proper answer. And with that, I would like to thank everyone, all our panelists, all our attendees who are present over here today. And our attendees who are there, there's a small bit of surprise for them. We have a small raffle draw for everyone who's attended today. Where we are, what we're going to do is my colleague who's present, she's omnipresent, you can't see her though. So she's going to do an online raffle draw with all the attendees. And we have a small token of appreciation in terms of an iPad that we're going to give out to the winner. So I would request my colleague Priya to probably, yes. Can we start with the raffle draw? So congratulations to Faimuddin Khan. Congratulations on winning this iPad. Our teams would be in touch with you to probably hand it over to you. And I also remember he was pretty excited in the beginning and asking a lot of questions as well. So I think it's worth it at the end of the day. Thank you everyone for joining us. I would really like to thank our panelists, especially our guests from Saudi Arabia, Hamza Batterjee, Engineer, because I think we all agree that the role that the Saudi Arabian healthcare industry is playing, not only in terms of how they're progressing in the sector, but also the benchmark and standards they're setting, vision they're setting for the rest of the players from across GCC and Middle East to follow. I think that's a very important step. Thank you so much, Rani, for joining us. And I'm sure it was a difficult thing for you to take some time off from a 24/7 busy schedule. But I really appreciate you joining us. Thank you, Sebastian. Thank you, Hof, for being a part of this. Definitely wouldn't have been possible without you guys. Raziel, thank you so much for being with us today. And it's a pleasure to have you all. With that, I would like to conclude the webinar that we've had today. We would be sending the information. I think a lot of people have requested a presentation from Sebastian. If Sebastian is comfortable sharing that, we would be sharing a PDF copy with the attendees as well. And we would be in touch to discuss this in future again. I would also send out, obviously being Khaleej Times, I think it is a wonderful story for us to cover. So when we do that, we would send out the links to the articles to all of you all involved. And thank you so much for being a part of this once again, and have a wonderful day and stay safe.
Thank you very much.
Thank you so much. Before everyone logs off, also the attendees, I'm sorry, I should have mentioned at the start, whoever is remaining, if my colleague can just promote all of them to a panelist, we would probably do a virtual selfie with the screenshots, and I would request all attendees to switch on their cameras. That would be a great idea. Priya, if you could just promote the attendees to the panelist segment. And I would request all our attendees to kindly switch on their cameras. Well, all the attendees who've just been promoted, I think you'll get the option of switching on your cameras if you can do that. Wonderful, wonderful. And I would request the others as well, Ms. Amir Ali, Mr. Fadil Hussain, Mr. Islam, Al Faizer, to probably switch on your cameras as well. Thank you so much, I really appreciate it. Mr. Bandar, if I would request you to switch on your camera as well. Thank you, Asnan, for switching on your camera. Thank you, first of all, to all our attendees for joining us today. Wonderful. I mean, although there's going to be no sound of a camera clicking, I'm still, for the sake of my colleague who's going to...
Hello, brother. Thanks. There was a technical problem with the mic. Thanks a lot for this comprehensive webinar, and for the speakers. It was rich data we have got from this.
Thank you so much. And that was the whole idea. So I really appreciate your kind words. As I was mentioning, that there would ideally be sound of camera clicking, but just for the sake of camera, we're going to say cheese. 3, 2, 1, cheese, everyone. And Priya is going to take a screenshot of this. Yep, thumbs up works best. Yes. I think Sebastian is coming up with gang signs. Yeah. Wonderful smiling faces, and I'm sure it's been a busy phase, so I'm pretty impressed that everyone's able to manage a smile. Thank you so much, everyone. Thank you so much, everyone. More like unsung heroes, because we obviously are celebrating the caregivers who are handling the patients, but we also need to thank the support function that is enabling them, that is helping them deliver the best of the services. And you guys are at the core of the services that is being provided. So congratulations to all of you, and it's wonderful to have you all. We would probably compile, the key takeaways from this webinar, so that it will be handy for all of you all to, when you are considering your future plans as well, and we'll be in touch with you on that. Thank you so much. Wonderful. Thank you so much, everyone. Have a wonderful day.
Thanks a lot.
We'll be in touch. Take care. Bye-bye.
Really?